Oh, thank you everybody for attending this webinar. My name is Desmond Byrne, and today I'm just going to talk to you a little bit about the fact that I've noticed in the last while that compounding is getting busy. A lot of people are starting to think a little bit about how to grow the business and also about how to put in place the systems, processes, and maybe the staff to sustain that growth. And so what I'm going to talk about a little bit about today is to, instead of thinking about maybe increasing number of staff, how can this particular program help you contain your costs? I decided to do it because quite a few of our members using RX Mobility have told me very specifically how it reduces phone calls and interruptions and thereby has improved productivity. Really, we wanted to get that across to people and sort of frame RX Mobility in that context and to quantify it for you. Just to give you some background as to what RX Mobility is, RX Mobility comprises three things. It's a mobile app that your patient downloads. It's got a pharmacy portal that connects into PK Compounder RX software. And PK Compounder RX is upgraded in a particular way so that it can work seamlessly with the mobile app. So it comprises those three things: an app the patient downloads for free, a pharmacy portal, and an upgraded version of PK Compounder. In terms of its benefits, and in terms of productivity, I'm just going to concentrate on two of the benefits today, but one is it does reduce call volume, both inbound and outbound calls, and it does reduce interruptions. There are other benefits to the tool that I won't concentrate on so much, things like increasing refills, simplifying the workflow, and improving patient compliance with their medications. I won't go into those today. I'm going to concentrate mainly on call volume and interruptions. And just to go in then in terms of the detail of what the mobile app is, it's a pharmacy branded app that your patient downloads for free. So if your business is, whatever your business name is, that's what the patient looks for on the App Store. That's what it's branded as. It's your colors, your logo, your everything. Patient downloads that for free from the App Store. It contains a variety of different things related to the business. So things like pharmacy information and directions, services that you provide, Facebook, website, etc. But then once the patient has it on their cell phone, then you have basically a conduit into which you can communicate with that patient. Things like you can tell them about the pharmacy events and promotions. You can communicate to them about scripts. What the patient themselves can do is they can submit refills. They can receive refill reminders automatically generated by PK software. They can stay informed about news and events in the pharmacy, and they have immediate access to script history and updates. And in terms of the mobile app is one thing, but one way to think about this platform is really that it's a platform for your business. And it's not just about a mobile app. Like the refills are entered directly into your PK to-do list. So if a patient puts a refill into the app, it comes straight into your to-do list. Refill reminders are automatically generated and sent to that patient as a push message, and are generated using the day supply in PK, and it also incorporates and factors in your lab lead time. Patients are informed about script statuses automatically, and also patient script history is on the device so they can access it at any point in time. And just to go into RX Mobility and the type of ways it can reduce calls. So a key component of RX Mobility is how it reduces both your calls to patients, which is and can be very time consuming, and it also reduces your patients' calls to you, which tends to be a source of interruption. And I've started quantifying the types of calls that patients might make, and there will be others, and I'd love to hear them, if you want to pop them in. But the ones that we hear are refill reminders, so you're reminding the patient to refill. Pharmacy staff might want to verify the order coming through. They may want to call the staff or the patient for the script is telling that the script is ready. Maybe to facilitate a payment, or maybe there's a problem with the script. These things tend to be time consuming and very laborious, and I've numbers pulled together on that. But there are other things for related to phone call sources from your pharmacy staff. And listening to members of PCCA that I've spoken to over the last while, I'm thinking that per refill script, you're doing between about 1 to 3 calls. Now, some members say that they're not making any outbound calls at all. But I'm hearing 1 to 3, one being a refill reminder, a second might be verifying the script when it comes in, a third might be calling the patient, telling them that the script is ready. So somewhere between 1 and 3 seems to be an average. But ultimately, this is a source of cost, because it's very unproductive time and it's very time consuming. And so we try to, get feedback from members and then use best in class industry metrics to understand actually what is happening when you're making phone calls. So when your staff are making phone calls, what actually is occurring in terms of time consumed. So I've put some numbers together just to give you a feeling for it. And these are based on feedback plus what I've seen in professional call centers. So call setup time, about 30 seconds. That means looking for a number and dialing it. Let's say 30 seconds. The number of seconds it takes to answer a call, again, average at 30 seconds. And that factors in things like not answered or wrong number dialed, and then someone answering. Seconds to connect to the correct person, again, another 30 seconds. That factors in things like voicemail, not available, or waiting for the correct person or patient. Talk time duration, I'm assuming 120 seconds for that, and data entry would be another 120 seconds. And to put it in context of what a professional call center looks like in terms of numbers, a person who's in a call center, and it would be a sort of a mid to high contact level call center, not just dialing all the time and looking for 10-second calls. They are doing about 25% talk time. That'd be a target. So their target would be talk to the recipient of the call, or recipients of the calls, for approximately an average of 2 hours out of an 8-hour working day. So the other 6 hours out of their 8 hours are effectively calling people, not getting through in voice messages. So that gives you a sense of what the actual numbers are in a professional setting. If I was to look then at, look at our compounding business and just have a look at what happens in terms of factoring in those numbers into the amount of time it's taking you to do calls. So if the top line there is on 10 calls a day, what's occurring? Well, if no calls get through, then you're consuming only 0.2 hours of time. If all of your calls get through, you're just short of an hour. And if 50% of your calls get through, you're talking about a half an hour of call time, approximately. That's if you're doing 10 calls a day. And that's based on those metrics, those call metric assumptions that I've put on the left-hand side. Equally, if you're doing probably 25 calls a day, which, 25, 50 calls a day, which I sense is sort of the number for people, 25 calls a day. If you're not getting through at all, it's just short of half an hour call time. If you're getting through to everybody, it's 2.3 hours. And if you're getting through to approximately half the people, it's 1.4 hours of time. And that gives you a sense of the sort of amount of time that it takes to actually affect these calls. And it may be one person doing it, or it may be multiple people doing it. And of course, you may have more than one call per actual patient per script. It could be, what I think is somewhere in the range of 1 to 3 calls per script. So 10 calls in a day might only be somewhere between 2 and 3, 4, 5 scripts. 25 calls a day, somewhere between 3 to 9 script related calls. And just to think about the 25 calls a day, if you could replace 10 of those calls, and that's only 10 calls, so that's somewhere between 3 to 6 scripts, somehow that they were dealt with in a different way, then you'd be saving approximately 32 minutes per day. So for every 10 calls you can stop doing, that's approximately 32 minutes. And so if that, you can work it upwards as well. If it's 100 calls that you're targeting to save, then that's 3,200 minutes a day, which is a significant amount of call time, and a potentially huge area of productivity gain for your pharmacy. That's not the only source of calls, because the second source of calls are from patients. Now, typically, these calls are quicker. They do take time, but they are quicker. but they are a big source of interruption, and maybe that causes more difficulty in the pharmacy, particularly with respect to errors or workflow related issues. And the reasons that patients can call, and there will be others, but these are the ones we've seen, so they're calling in a refill. And they either do it and they get through to somebody when they get through, or you have an IVR and they go through and automatically just leave it there. There could be an expedite request. Maybe they got the refill not on time, a refill reminder not on time, or they just need to expedite it. Maybe they want to check the order status, or they have a question on the script, or there's a delivery status question. But bottom line is when a patient calls into you, it's going to interrupt you. As well as taking time, it'll actually interrupt what you're doing. If, for example, you're in the middle of in the lab doing something, then it's going to interrupt you while you're in the lab. And again, I've been looking at a lot of things related to the role of interruptions on errors and efficiency in a pharmacy. And it's really very hard to get information on this, and I've gone to a lot of different sources, and I couldn't get anything on compounding, so I had to rely on other areas to give you a sense of what's in other types of pharmacy. But according to a practice called Safe Medication Practices and Interruptions, it was a document published by the American Pharmacists Association and also by the Institute for Safe Medication Practices and Interruptions. Approximately 98.3% accuracy in dispensing medications across the industry is what people are seeing. That if you break that down into different types of pharmacy, in terms of accuracy, hospital pharmacy is actually worst, chain pharmacies are next worst, and community pharmacy is the best in terms of accuracy when dispensing. And that gives you a sense of the type of accuracies that can get introduced when people are interrupted. In another environment that I was analysing, which was a study which was the impact of interruptions and distractions on dispensing errors in an ambulatory care pharmacy, basically they had discovered they had a 2x or increase in errors when pharmacists were interrupted when they were actually dispensing. Now, it was a very high number. It was only one particular pharmacy, but it was studied over a longer period of time, and they analysed thousands of interruptions and thousands of items being dispensed. And they broke down what were the reasons for type of interruptions that were coming through for this ambulatory pharmacy. But the actual increases, the errors increased from about 3 to 6.5% when a pharmacist was interrupted in the middle of dispensing. And then the table on the bottom left-hand side there, that's actually showing you another type of pharmacy. Again, it was an analysis of a hospital-based pharmacy that was just short of 250 beds in this particular hospital, and they analysed the sources of interruptions over a longer period of time and the impact of those interruptions, again, over a longer period of time, over thousands of scripts. And what they found were things like clarifying medications were a quarter, 27% of the reasons for interruptions, transferring calls, simple thing, 15%, missing medications, 11%, confirming orders, 26%, checking up orders, 11% of the reasons for an interruption, change medication, 3%, personal was only 1% of calls, and hurry up, 5%. And when I went into different reports and different analysis, I came across a very good report on preventing medication errors in community pharmacy. It was a root cause analysis of transcription errors. It's published on the NCBI website, so you can get at that link on this webinar. And they came across their analysis that the root causes for these errors being introduced were handwritten scripts, lack of effective control of prescription labeling medicine, which was mainly a software issue, so therefore out of your control, and lastly, interruptions. And they concluded in the report that it's a distinct effort to reduce interruptions and distractions in the pharmacy will not only reduce errors, it will also improve efficiency and enhance job satisfaction for all. I couldn't get quantified numbers for this, but I do feel it's a huge source of interruption, of inefficiency and errors in the pharmacy business. how does our program work to reduce calls and interruptions, and why does it work? So just tell you why it works. It works because you're removing phone calls from your workflow. It works because you're giving patients control plus visibility of their scripts and refills. And it works because patients are entering scripts directly into your workflow or directly into your PK to-do list. And that's why it works, why it can reduce phone calls and interruptions. And give you a feeling for what that looks like, I just put a couple of screenshots or a couple of slides together. One here is the person enters in the script number and their date of birth. They press the refill button and they get a message back telling them that the order has been accepted. That comes back pretty much instantaneously, plus the script is entered into your to-do list. In terms of the scenarios then that can occur for the types of things that the patient would see, there are the app contains RX script history, so all of the history associated with that particular script is available to the patient, so they don't need to call you to see what's going on with the script, what's the status of the script, what did I do last month, have I got a reminder. It's just all going to be available for them in the actual app itself. So the script history is there, therefore they don't need to call you. In terms of the type of communications that occur for different sort of script statuses, let's say a valid script, then a refill is just entered into your to-do list. The app is updated with additional patient and script information, and the patient is sent a message pretty much instantaneously that the order has been queued for processing. There could be an invalid script scenario, and in that particular instance, the script is not entered into the to-do list. No patient data is sent to the app, but the patient is sent a message that the order is rejected along with a reason, either an invalid date of birth or an invalid script number. They can elect to actually try and enter it again. And then there's a variety of different scenarios where the script actually needs to be reviewed and the patient actually needs to be told something related to that script. And the primary conditions when this occurs are the prescription has no expiration, or the prescription has expired, or the prescription has no refills remaining, or the patient is attempting to refill too soon. In this scenario then, the script is entered into your to-do list, so you know that you can do something with the script. The patient is sent a message, and the message is detailed on the table there. So for example, if the prescription has expired, then the patient is automatically sent a message that the prescription has expired, we will contact your doctor, for example. If there's no refills remaining, the message goes back to the patient, your prescription has no refills remaining, we will contact your doctor. So these are automatically happening. They don't need to call you and try to figure out, it's expired or there's no refills remaining. They actually get a message back communicating to them your next step. A couple of things on this. If you create new from old script and PK, then the app updates automatically. That's important. And early is defined as being less than the 80% of the day's supply. So it's approximately on a 30-day cycle, it's approximately 24 to 25 days is when, less than 24 days is when it's defined as being early, but it'll still go into your to-do list. So that's when the script has to be reviewed. When dispensing, it's another area that people may want to call through to you about. When you dispense a script that's come in from the app, then automatically a script message gets sent, or a message gets sent to the actual patient that the item is ready and it's been dispensed. And this particular dispense point is set up with you and by PK when they're upgrading your PK software. And so it works with all of the major tracking systems, so RX Watch, Location Tracker, all of the different tracking systems that PK are using within PK software. Probably one of the key features I think of this whole program with respect to improving and reducing calls and interruptions relates to script reminders. The script reminders are sent automatically to the patient that via a push message into the app, and it's calculated using the day supply in PK, and it also nets out your lab and delivery lead time. So when you're setting up the app with us, you select a lead time, and it can be whatever you want it to be. Typically it's 2 or 3 days. So you put in, let's say, or the example I've used here, let's say you have a lab lead time of 4 days. If the day supply is 30 days in PK, lab and delivery lead time is 4 days, then the reminder gets sent to the patient on day 26. So you have enough time to actually produce the compound in the lab, plus ship it to the patient for them to get it on time. That's a key part of reducing phone calls and improving efficiency and productivity. So let's just go back to where I was at the start of this, talking about replacing phone calls, and sort of give you a quick summary as to how that happens specifically by say phone call type, by pharmacy staff, and how the app can help that. So replacing phone calls by pharmacy staff with the pharmacy app. First one is refill reminders, and refill reminders automatically are generated based on a day supply minus your lab lead time. Order verification, again, it's automatically confirmed and sent as a push message to the patient. Script ready, again, a script message is sent to the patient automatically when the item is dispensed. The program still doesn't do payment facilities. It is something that we might look at in the future. So that's not possible yet via the app, other than to say how the item will be paid for, because you can set a selecting related to payments. And also problems with scripts, you can send a manual push message to the patient about delays or other things that you may have related to that script. So instead of being time consuming and laborious, it is a more automatic process and reduces the amount of calls that you have to make to patients. And in terms of replacing phone call interruptions, again, let's look at it. These are the calls that are coming in by patient. So if they want to call in a refill, and that happens, that can be replaced with the app. Refills are entered directly into your PK to-do list. They want to submit an expedite request. Well, probably we'll have to do less of them because the refill reminder is sent based on your lab lead time, so it's actually sent early. And if you've got a particular refills that are on a longer lead time, or patients that are take a lot more time, say, to submit a refill, you can actually change that by script. So instead of being 4 days, you can say it's 6 days. Checking the order status, well, they won't need to call you to do that because the script status and history is on their phone. Script questions, again, script status and history is on the phone. And delivery status, well, it's automatically updated when the item is dispensed. So this is sort of how you reduce calls and save those 32 minutes I talked about for every 10 calls that are not happening in the pharmacy. Thank you very much, and very much appreciate your time. Thank you.